with a very simple remedy. And the remedy was asculacy. So any quick questions in asculacy? Before I start with a new remedy, if you have any quick questions related to asculacy, we'll take up the questions. In case if you are all clear with asculacy, I'll be starting with a new remedy. Okay. Okay, fine. I mean, that was your first class and many of the boys were missing on that day. Okay. So we'll have a quick recall of what was done. So what was done? I mean, when I say asculacy, what should come to your mind? Huh? Think. What is it? Okay. It affects the lower bowel. Okay, yeah, very good. Yeah, I'll come to it. So, it affects the lower bowel and it causes varicosity, and it's also a very good remedy for hemorrhoids. And what I told you in our local language, we call it as piles. But the medical term is hemorrhoids. Okay. Now, we also try to understand the peculiarity. What was different in asculacy. And we also discussed, the other remedies that we studied in first year for hemorrhoids. Okay. Now, what was different, what was peculiar in asculacy? One, your friend already said that the appearance. In aloes, how was the feel? Like bunch of grapes. In asculus, the feel is like that of a groundnut. Groundnut. She was using the word peanut. Groundnut. Right? And the other very important point in asculus is, okay, there is dryness and you have the sensation of sticks, small sticks in the anal region. Absolutely right. Good. Anything else?
Knives.
As if knife has been pierced. Yes, good. That's a point. As if knife has been pierced. Good. Anything else? And yeah, that's very, very important. In asculacy, hemorrhoids are associated with back pain. Back pain. Low back pain, very, very characteristic. And we also gave you a few words. Hemorrhoids which are purplish, hemorrhoids which are blind. And I also told you what exactly we mean by blind. Which are non-bleeding. Non-bleeding hemorrhoids. Very, very characteristic. Okay. Anything important? See, our focus was exclusively on the rectum. And I also told you, and the same thing I will be repeating here also, teaching materia medica for different years it will vary. For example, if I teach asculus for PG, then the information that we give will be a little different. So CBDC they have classified. There are three very important components here. What is it? Must know, nice, desirable to know, and nice to know. Three things. Okay. And we are mainly focusing on what is that must know area. Okay. So in asculacy, the must know area for a second year student is the rectum. Okay. There can be few more things which I have told you, which are desirable to know and very minimal. Like for example, the common name, the part used, who proved it, they can be nice to know. Nice to know. Hope I am clear. Okay. Now we'll start up with a very interesting remedy. And again, second year, this is our second remedy. I'll again start with a very simple and a small remedy. Okay. Kindly focus. Any confusion, any clarification, as and how the remedy, the PPT unfolds, you can always stop me and you can question me. Okay. So post-lunch session, we'll start with a small situation. And what is the small situation that you see here is, the situation is, what is the small situation that you are seeing here? Huh? Okay. So you have this 30-year-old lady with, she approached a homeopath with an injury. Okay. Now as a second year student, again see, this is what I am trying to highlight. As a second year student, what remedies come to your mind, or before you start shooting the remedies? I know first year remedies you are all very good with. Okay. Now what I was trying to highlight here is, when I ask you this question, what remedies come to your mind, there should be something which should also come before this. What is that should come to your mind? Beautiful. What type of injuries? Okay. Now here we'll take a small pause. What I was trying to tell you is what type of injuries. Luckily you are in second year. When I did arnica, when I did symphytum and when I did ruta and other remedies, injury remedies, if you remember I told you, when you come to second year and when we talk of injury remedies, we will be integrating with something. Okay? Now in which subject of second year the different type of injuries will be spoken about? FMT. Mainly FMT. Yeah, there can be little amount of surgery also, I don't deny. But the main integration that will be happening here is from the topic from FMT. There is a topic called as mechanical injuries. Fine. So what I suggest, after we are done with this class, please go back home and quickly have a look at the mechanical injuries. Okay. Now, beautiful question. What is the type of injury will also tell us which remedy can come very close. Okay. Can you give me some examples, quick examples? Based on the type of injury, what is that remedy that you are going to decide? Very good. For example, assuming if the injury is lacerated, the remedy lacerated injury is equal to remedy. Very good, beautiful. Any other examples? Contusions. Arnica. Good. Contusions. Punctured injuries. Beautiful, good. Nerve injuries. Beautiful, good. Yeah, any other injuries? Okay, there is also a remedy which your friend is trying to tell. Okay, we will look at it. Is that done? Is Bellis done? No. Okay, good. Thank you. Because that's the remedy I am going to tell. I was shocked when he said Bellis. Okay. See, now this is the beauty of the class. Many times during our school days, college days, the remedy that is already told we don't remember. Now you are talking of a remedy which is not done. Fine, good, keep it up. Okay, anyway, we'll come back. So we have a lot of remedies, we have a lot of injuries. Based on the injury, we can also think of a remedy. That's what I gave an example. Assuming if this 30-year-old lady came with lacerated injuries, then probably you can think of calendula. If she had a bruise, if she had a contusion, it can be arnica. If she had a fracture, it can be symphytum. One more remedy? Ruta. Symphytum ruta. Okay? And if it was a punctured injury, as one of the people said, it can be redder. Or if there was a small foreign body. Right? You can think of Silesia, which I told you in first year. Silesia has a capacity to increase pus formation and then the foreign body will be expelled out. And that's why we also call Silesia as beautiful, good. I'm happy post lunch if you make so much of noise. That's a great thing. Okay, so anyway, we'll go ahead. So it can be any of those remedies to keep the class active. Now what we are trying to understand today is a remedy, okay, which predominantly is an injury remedy. Okay, and again from your FMT classes you will realize this injury is what we call it as bruise. Or it can also be called as contusion. Okay. Now what happens in a bruise or a contusion? Okay, capillaries break out, rupture, and then you have extravasation and you have blood, you have bleeding. Okay. I am not giving you the exact definition given in your FMT, but this is what vaguely you need to understand. Okay. So going ahead, what you need to understand is bruise, yes, and we are also trying to integrate this with our FMT topic, mechanical injuries, and what are the other remedies that you can recall from your first year syllabus? Yes, arnica, very good. Okay, ruta, to a certain extent ruta, but ruta is a remedy which predominantly acts on the bones and tendons. If you have a tendon injury, okay, or if you have more than an injury in ruta, what do you see in tendon? What do you see in tendon? Huh? Very good. You see a nodule. Beautiful. Good. Please remember, keyword, nodule. And what did I tell you in first year when I did ruta? I showed you a picture of wrist. Who was that? Ganglion. Ruta is a beautiful remedy for ganglion. So on tendon, it can act and it can cause extra growth. Rightly said nodule, rightly said ganglion. Okay. So here what I want you to understand is, The remedies that we have predominantly for a bruise is arnica, and I have given you remedies which are not yet done. Okay, so that you should also develop that habit of thinking beyond. Okay, for example, conium can be a beautiful remedy acting on, or a beautiful remedy for bruise. Not only conium, calendula, restox, symphytum, which you told is a remedy for bone injuries, or it can also be a remedy by name sulfuric acid. There are many more remedies in our homeopathic literature. I am just giving you the creamy ones, the topmost remedies for bruise. Okay, and purposely I have just one remedy because that is the remedy I am going to discuss today. Okay, so any vague idea from your pharmacy knowledge? Huh? Any vague? That day is vague Bellis before okay, so anyway, he is absolutely right. I am trying to snub him. See, when somebody reveals the answer no, before your teacher does, your teacher will get a little irritated. Because from 2 o'clock he is shouting Bellis, Bellis. And I am getting heated and inside. I don't want that remedy. I don't want to hear that. You tell me anything else other than Bellis. Because Bellis is what I want to start. Fine, anyway, keep it up, good job. Bellis is the remedy that we are going to discuss. Now, if you just see the build-up now, the name Bellis comes later. You will understand my agony, my pain. Why I was trying to snub this guy. So what I was trying to tell you is, I wanted to show you this picture. And must be a mistake of asking your class, what is this picture? I should have just kept quiet. Fine, anyway, this is the thing. Now it is being used since ages. Please make a note. It's been used since ages for bruise. Spelling mistake, don't worry. The roots and leaves were used in wounds. Drinks were considered efficacious in removing extravasated blood from bruise. Meaning, what is the source that we are trying to look at? What is the source? Please go back to your first year. There were different sources. So this was more, no, we are not looking at that source. I am trying to tell you the homeopathic sources. So this is more of empirical. This is more of empirical, meaning it is more of experience. So since generation, they were using Bellis as a remedy for bruise. Nobody experimented. Please mark the word. It is out of experience. That's why the word empirical came in. Because we are not experimented. Fine. So homeopath then started experimenting, then started proving, and they realized that this remedy is a beautiful remedy for bruise. Okay, we'll just have a look. The common name, bruise wart or wound wart, indicates its action in injuries to deeper tissues. See, these are all keywords. Now you should be getting other remedies. Now for example, I told you about arnica, I told you calendula. I will be talking about other remedies. So the question here is, after 30-40 minutes, a question might come up or you might get confused. Sir, how do you differentiate arnica from Bellis? Okay. So in my lecture itself, I am giving you some clues. Please pick up the clues and we will have a small discussion at the end of 35 minutes how Bellis can be differentiated from arnica. Okay. So injuries to deeper tissues, and the common name is English Desi bruise wart, wound wart, because it was treated to cure, or it was treated in treating bruises. Okay. So moving ahead, the plant, the whole plant when in flower. Now this is the situation. So this is the part that we use in homeopathy. And I also wanted to tell you that this belongs to a natural order, Compositae. Okay. Now any other remedies that you can recall? Like for example, you also had calendula, arnica, many injury remedies. Yes, many injury remedies. They were from the natural order Compositae. And now I wanted to reveal the name. The remedy that I am going to share with you is Bellis. I hope you understand the build-up. Right? So Bellis came here, but luckily one of your friend, I appreciate the moment they saw the image, he said Bellis, good job. Okay. So this is just the introductory part, which can be nice to know. Okay. Now going ahead, what is that we are planned for next 30-40 minutes? Now at the end of the session, the learner should be able to, it's a very small remedy, simple remedy. Our main focus is on the sphere of action, on the pathogenesis. We are looking at these two things, and then we are also trying to list the characteristic symptoms of Bellis spur. Okay? And very important for a second year student, for your theory and for your practice is injuries. A sure question which can come for 5 marks. Describe the injuries of Bellis spur. One of the probable questions which can come in your theory exam. And any of these things can come up for your viva. The sphere of action, the characteristic symptoms, they can come up for your viva. And of course, we'll be also mentioning the modalities in the end. So, 4 small objectives for today's class. So, moving ahead, we'll be focusing on the first area. And what is that first area? Sphere of action and pathogenesis. Okay. See, we did that in Ascolas few days back, and we'll be doing this with Bellis. From your knowledge of anatomy, see the beauty of materia, because you are in second year, we are not forgetting anatomy and physiology. Right? We are making our best efforts in integrating anatomy, physiology, pharmacy, and of course, the second year subjects, so that you understand materia medica much better. Okay? So, what do you see here is, what do you see here? Okay, muscle fiber, fine, and I'm trying to focus on the blood vessel. Okay? Acting on the muscle fibers of the blood vessel, fine. Bellis causes congestion, venous congestion. Does this word venous congestion remind you of any other remedy? Very good. Asculus. Now, how was Asculus different from Bellis? So in Asculus, the congestion was very specific to the lower bowel. It was very specific to the lower bowel. Here it can be any vein. Here it can be any blood vessel. Acting on the blood vessel, it causes stasis, it causes slowness, and it causes varicose veins. Now luckily, after Asculus I have taken up Bellis. In Asculus also you saw venous stasis, but you have to understand the difference. In Asculus, the venous stasis was more predominantly in the portal vein or the lower abdomen. Now here you see, it can act on any blood vessel of your body, and it can cause stasis and it can cause varicosity. Hope I am clear. Okay. So moving ahead, the second very important thing is the action of Bellis on nerves. Again, as a second year student, when I say nerves, what remedy should come to mind? Hypericum, very good. You will have something related to hypericum. Okay, only hypericum acting on nerves? Any other remedies? Gelsemium, very good. Very good, Ailment, good. That's the remedy I wanted. Gelsemium, Ailment, hypericum, good. Any other remedies acting on nerves? Belladonna, okay, good. Any other remedy? You can also answer. Any other remedy? Who was it? Yaro Naxwameka. Yeah, very good, Naxwameka. Fine. Now, what do you see in Naxwameka? Beautiful. She is complimenting. One of your friends said Naxwameka, and the other friend immediately said, sir, it causes hyperesthesia. Beautiful. So, acting on the sensory nerves, please take it right. Naxwameka acting on the sensory nerves, it causes hyperesthesia. So, how will the patient present to you in your clinic tomorrow? How will the patient present to you tomorrow in your clinic? When there is hyperesthesia of the nerves, which nerve? Sensory nerves. Very good, beautiful. Sensory nerves. So, how will they present to you in clinic tomorrow? See, this is applied materia medica. Fine? So, what will they tell? Like, for example, they are very sensitive to smell. Or, like, for example, if you want to touch them, they are not like you touching them. They say, please switch off the light is too bright, fine. And can you talk in a low voice? It's irritating. You are talking in your normal tone, but for an astronomical person, because of that hypersensitivity, even that small tone, for them it will hear as if it is something big. Dira baat kar. I am not deaf. He gets angry. So that is how you start applying. So acting on the sensory nerves, nextnomic causes oversensitiveness. Acting on the motor nerves, beautiful, good. Acting on the motor nerves, it causes paralysis. Good, paralysis. That is nextnomic. You are talking about Ailment. Neuralgia, very good. So in Ailment, you see, why I am trying to compare, you want this? Or if you feel secondary it is too much for us, please spare us, sir. No, nothing is too much. Everything is too less. Very good. See, that is the student attitude you should have. बोलो सर, बाद में देखेंगे. आप अपना काम करो. हम लोग हमारा काम बाद में करेंगे. फिलहाल आप अपना काम करो. मेरा काम क्या है? सिखाने का, बोलने का. So what is that she was trying to tell is, Ailment will not cause sensitivity. Ailment will not cause paralysis. I hope you understand. Ailment causes neuralgia. You get my point? Ailment causes neuralgia. Somebody has talked about hypericum here. Why can somebody quickly tell me hypericum? When hypericum in nervous affection? When you have injury, compression, crust injuries to the nerves, then you can think of hypericum. Okay. Chamomilla also has an affinity for nerves and it again causes oversensitiveness. And what is that they are very sensitive in chamomilla is to pain. They cannot bear pain. Right? So oversensitiveness to pain. Even small pains chamomilla cannot bear. Right? That is chamomilla. So we will get back and I want you to understand that Bellis spur, like hypericum, causes neuralgia. Beautiful remedy for nerve injuries. Beautiful remedy for nerve injuries. Right? Many times we think of hypericum, but you can also think of Bellis. And it is a remedy which has an affinity for muscles. Again, when I say muscles, what is the first remedy as a second year student that should come to your mind? Very good. Arnica. Arnica. No, Restox is also there, I don't deny. You are talking about Rota, it is also there, I don't deny. But Arnica, myalgias, sore pain in the muscles, myalgias, you can think of Arnica. You can think of Arnica. So Arnica, fine for muscle pains. Same, you also have it in body, you have it in Bellis, a very good remedy for muscle pain. So this is the sphere of action and pathogenesis. Any clarification? Okay, so assuming this is clear, anyway we will come back to this a little later. Now the second very important objective is ailments from. What are the causative factors in Bellis and what will these causative factors cause? Okay. What type of injuries? Bruises. Okay. Fine. Conditions as ailments from ice creams. Don't look at cone cup. I did not have this in my mind when I picked it from Google Images. Ice cream. Don't tell me cone ice, cup ice. Okay. Fine. Ice cream. Okay. Any other remedies as a second year student? Very good. Pulsatilla, arsenic. Good. Appreciate. Pulse arsenic. What will happen in pulsatilla? After eating ice creams? They will generally have gastric complaints. Diarrhea after ice creams. Arsenic can have respiratory complaints. Arsenic can have headaches after ice cream. One more important situation, I feel you know this, it's already told in one remedy in first year. Ailments from drinking cold water after getting overheated. Roenia, Restox, Belladonna, Aconite. Any other remedies? Antimonium crude, good, 5. So what happens in antimonium crude? Are they drinking water in anthem cold? No, good, I am happy you thought of anthem cold. But what will happen in anthem cold? Swimming, river bathing, under hot sun, and then there are some respiratory complaints. The remedy is antimonium cruda. Okay? Here the right remedy is bryonia. What will happen in bryonia? Gastric complaints after eating or drinking cold, especially drinking cold. Okay, that is bryonia. Similar situation, you also have it in Bellis. Now what is that similar situation? What is that similar situation you have in Bellis is that, they will have pain abdomen. Pain abdomen after drinking cold when they are overheated. And you have this, which you told me, injuries. And injury that also was very specific in Bellis is bruise, contusions, bruise. Okay? Ailments from getting wet. Better remedies? Rest of good. Dalkamara. Very good. Rest of Dalkamara, Arsenicamal. Okay? Good. Chalo. And ailments from overstrain, overexertion. Again rest of, again Rota, good. Symphytum. Okay, chalo. Ailments in old gardeners. If you just say, I should have asked you this question, but anyway, ailments in old gardeners. People are old and are doing gardening job, and then they have some issues. We'll explore what exactly they will have after some time. But for time being, ailments from this and ailments from masturbation. Ailments from masturbation. Any other remedy? Lycopodium good. Barretta. What will happen in Barretta? Heart complaints, chest complaints, palpitations after masturbation. Very good. There are many remedies. Bufo, Staphysagrida. Okay, lot of remedies. Caladium. Yeah. Now, another very important thing is, what do you see from the image taken? Travelers. Don't look at the flight part, just look at the lady here. Fine. I know many people telling we are looking only at the ladies. You have mistook and you are asking us to look at the flight. We just realized after you told that there is also a flight there. Our focus was here. But anyway, that's what I wanted. See, now what I wanted here is commercial travelers. Meaning people who keep traveling very often. Fine? And if you just see, there is a statement, railway spine. There is a statement, if you read books, good material books, they say Bellis spur is a very important remedy for railway spine. So people who keep traveling a lot in train, this was proved during Ailment's time, they are traveling in train, fine, or it was proved a little later in train, and then they sit for a long time, and then the back feels sore, then that situation is what we call it as railway spine. So Bellis is the only remedy mentioned in our Materia Medica for railway spine. So this can be a viva question for you. You getting my point? Name the remedy for railway spine. The remedy is Bellis spur. Okay. So these are all the ailments, causative factors. Ailments from operation, even you can include that. Ailments from operation, ailments from surgery. I will explain that a little later. So this is the second objective, ailments from. Okay. Any quick questions? Clear? Okay, we'll go ahead. We'll look at, this, I just prepared the PPT. Till 2 I was busy preparing the PPT. Now I purposely got this umbrella picture. You know why? Because you see Bangalore it's raining. So I thought let's sync the weather with our PPT. Now apart from the rain, you also see something different here. So everybody are keeping a different type of umbrella, and this one man who is having a red umbrella. So our next heading, we are focusing on the characteristic symptoms of Bellis. So what is that which is individualistic? What is that which is special, characteristic only to Bellis? That is what we will be discussing. And from knowledge of anatomy, you know that the organ spleen. Fine? Unfortunately, you all pass anatomy. The tragedy. But no issues. I purposely got an image which will confuse you post-lunch. Post-lunch. Because post-lunch you will all be thinking it's a kidney. But then it's a spleen. Fine? So, a remedy which affects the spleen, it causes enlargement, okay? It can cause fullness, heaviness, and it can also cause stitching type of pain in the spleen. Stitching type of pain in the spleen. And one more gastric related symptom I have clubbed here. Foul, painless, yellow diarrhea, aggravation night. Please get the words correct. Foul. What do you mean by foul? Bad smelling. What remedies come to mind? Bad smelling, diarrhea. Very good, arsenic. See, when you tell a remedy, you need to be very clear and loud. Good, absolutely right. Arsenic. Carbobase. Aloes. Sulfur. Very good. Sulfur. Good. Okay. Painless. Painless. One remedy. I mean, there may be many remedies. Very good. Podophyllum. Podophyllum. Painless diarrhea. And yellow diarrhea. You have many remedies. Fine, yellow. Fine. And mainly it is seen at night. And what is this which we already saw a little while ago? Pain abdomen. What brings on pain abdomen in Bellis? See, this image, what are the other remedies you can think of from your first year syllabus? Collagen, very good. Magnesium phosphate, absolutely fine. China, allium cepa itself. What will happen? What is the cause for colic in allium cepa? Salad, very good. Cucumber, yes, absolutely right. Salad, eating salads, cucumber can cause colic in allium cepa. Now, what I am trying to tell you is, this is not allium cepa, this is not MacPhos, this is not collagen, this is Bellis, provided the pain or the abdominal complaints which comes after eating ice cream or after drinking cold when he is overheated. This is the symptom I want to highlight. Okay. Brackets you can write bryonia. Brackets you can also write calica. Calica. Gastric complaints after drinking cold in hot weather. Now this symptom we already discussed. Where did I tell you this symptom? Yeah, very good. Sclerofaction. So what was that you saw in Bellis? It acts on veins. And it will cause varicosity. Bellis, varicosity mainly during pregnancy. Varicosity mainly during pregnancy. That can be one symptom. And here one more symptom in Bellis. Can you recall one symptom of arnica related to pregnancy? One symptom of arnica related to pregnancy. Huh? Okay, more than urine incontinence. Boys? Huh? Very good. Correct tapamulana. Yes, you said something. Yeah, Andre, correct. Yeah, see, right now you don't worry. That's my headache. But at least cultivate a habit of answering. Very important. Yes, pregnancy. Very good. Abortion. Very good. You have abortions. Absolutely right. That has right? So abortion. Absolutely right. That's what your friend said. But you have something beyond that. Because she is already pregnant here. So meaning that abortion stage she is crossed. Correct? Now what causes abortions in arnica? Because he has raised abortions good. What causes abortions in arnica? Huh? Okay, very good. It could be a fall. Yes. Anything else? Only fall. Blow. Fine. For example, accidentally you fall, or purposely somebody is kicking, hitting. Fine. Now what is this? Ultimately it is a mechanical injury, and then there is a possibility of abortion. Arnica, abortion from mechanical injury. But I wanted something else here. And what is this? They are very, very sensitive to the fetal movements. I was doing a class 2 days back to your first years. I don't know, some remedy I was teaching them. I don't know, I don't remember. But what I was trying to narrate them is, Arnika, lady, see the irony, see the problem in Arnika. And what is the best part for a mother when she is pregnant? Huh? Yeah, I am asking mother, fathers are answering. So, what are they trying to tell is fetal movements. Fetal movement, fetal movement. I mean, see, not only for a mother, for a pregnant lady, even for the husband, it's a very nice thing. Many times the lady pulls their husband and she see, son, daughter, whoever it is, is kicking. And though he is kicking, the mother takes it so nicely. And she'll be waiting. Many times they are counting how many times he kicked, where did he kick. And they go crazy, they go mad. One type of mother. And the other mother will not like child kicking. I know, he is kicking me. See, not out of haughtiness. Fine. Okay, see, many of us are happy. I mean, that's what he was trying to tell you. But what I was trying to tell you is, Arnika, patient will not like the child kicking. They are very, very sensitive to fetal movements. When the fetus is moving inside, they will have a lot of pain. And that movement can be painful for Arnika. Fine? So, can we convert this into something very important? That's what I was trying to tell your first year students. See, this is something a lady or a partner is waiting for. And unfortunately in Arnika they will not like this. So the rubric that we have in Arnika is sensitive to agreeable impressions. Please get me right. Sensitive to agreeable impressions. So what is nice? Fine. What is agreed, what is normal? In Arnika that can become abnormal. Am I clear or am I confusing you? What is normal for all of us, for Arnika it can be abnormal. So, the fetal movement is what the mother will be waiting to enjoy. Arnika mother will not like this fetal movement because the entire muscles of the abdomen, the uterus, everything will be very sore and painful. And with that pain, if the baby is moving, she feels, pain is more. That is Arnika. Fine? So, please remember Arnika, and I want you also to remember Arnika here. Inability to walk. Arnika lady during pregnancy might walk stoop shoulder like this. Fine? Because she is not able to walk erect and all the muscles can go into spasm. So in some position she should be very careful and she should walk like this. Arnika. Fine? So inability to walk during pregnancy because of the soreness of abdominal walls and that of uterus is also seen in Bellis. Is also seen in Bellis. And old gardeners, you already saw this gentleman's picture a little while ago under Ailment stone. So what happens in old gardeners? So old gardeners, overworked old laborers and elderly working gardeners suffer from head symptoms. Headache, giddiness or anything to do with head, they can suffer. So this is what you have in Bellis. So what is the heading that we are discussing? Characteristic symptoms of Bellis. Okay? Done? Characteristic symptoms of Bellis. Now we will be focusing on the important part of Bellis. Not that what I told was not important, they are equally important. But for a second year student, this is the must know area. Okay? Fine? So what is that you have to remember here is a very important remedy for injuries. I took this again from Google Images thanks to somebody who has compiled. Sprain, what are the remedies? Restores, ruta, very good. Fracture, sulfide of ruta from a second year syllabus. Even Bellis can be a remedy for fracture. What is this? Whiplash. Huh? Okay, we'll come back. Cut. Calendula, very good. What is this? Grace. Bruise. Arnika. Bellis. Sunburn. Sunburn, okay, belladonna. Netrum, cantharis. Cantharis, don't forget cantharis. This, you know this. Splinter. Very good. Cilicia. Bite. Ledum. Only ledum. Apis. Okay. Burn. Again cantharis. sting, herpes pelvica, ledum, blister, again cancerous, castricum cancerous. So these are few remedies. Luckily I got this from Google so that we could compare. Now we'll focus on the injuries you have in Bellis. And I initially started with the common name. What was that? Bruise what? Wound what? So you know that it's a very good remedy for bruises, contusions. Okay. Beyond that, as a homeopath, in future you will also think of Bellis. Injuries to deeper tissues after major operations, especially on pelvic organs or abdomen. So please get this right. For example, if there is any abdominal surgery, okay, which is including the deeper organs, deeper structure, okay, and bad effects after that. I'll also slowly tell you what could be the probable bad effects for which Bellis can be included, indicated. That also will be sharing a little later. But for time being, deep injuries. Deeper injuries we can think of Bellis. One. First remedy in injuries to deeper tissues after major surgical work. Okay. Excellent remedy for sprains and bruises. Muscles are sore and bruised. Muscles are sore and bruised. Which is the other remedy? Arnica. Good, arnica. Injuries to nerves with extreme pain, amelioration, cold bathing, and injury to coccyx. What is the only remedy that you should remember right now is hypericum. Good, hypericum. Hypericum. Okay. See, this is a beautiful symptom. Cancer of breast, induration of mammae after contusion of breast. Please read this if you have not understood. Cancer of breast, induration of mammae after contusion of breast. So, you know, in Bellis, after an injury, you can also expect a tumor. You can also expect a growth, like you saw in ruta, growth. Fine. Here, the growth is after a blow. Fine. Assuming, you know, the lady had a hurt, injury, blow to her breast, and then the breast tissue, you know, goes into a cancerous state. Only two remedies you have in our Materia Medica. One I have already disclosed. The other one, you can either take it as an assignment, but then few of the enthusiastic students have given the answer, and the answer is conium. Conium. In brackets you can have conium. Okay. So cancer of breast, induration of mammae after contusion of breast. See, now I told you a very good remedy for abdominal operations. Okay. So for example, that particular injured or the operated area, if it goes into a septic state, fine, you can think of Bellis. Septic wounds of abdomen and pelvic organs after surgical operations, Bellis. Okay. Near and remote effects of blows, falls, accidents. Again, it comes very close to arnica. One more remedy, I don't know if it is over. Natrum sulph. And in natrum sulph, what is that you see? After head injury. Fine. 20 years back I had a head injury. It still pains doctor. We can think of natrum sulph. Okay. This we already discussed under ailments from commercial travelers who suffer from bruises, soreness, -railway spine. -railway spine. Okay. So